I start? Yeah. So, dear colleagues, I want to again start my presentation about the Ngenuity digital assisted visualization. And I want to thank Alcon for having me here, and thank you for being here. So, these are my disclosures. And what is the 3D visualization? It is probably the next thing in our surgical visualization, and mainly with the Ngenuity, we can turn every analog microscope to a digital microscope. What are the key benefits? We will have more precision, we will have more control and efficiency, and it's an indispensable tool for digital marketing, for knowledge sharing, for teaching, and of course, last but not least, reduced patient risk, because as we see more, we are allowed and we can do more precise work. This is the technological overview. The system is comprised by really amazing camera, which is with high dynamic range. I will explain what is high dynamic range and why it's so important later. Really fast computer which seamlessly produce image with less latency possible, which is important for our work, and of course enhanced 3D OLED 4K screen. So this is the camera with the high dynamic range. What is the dynamic range? This is the ability of single pixel to maintain high quality image no matter the low light condition and the high intensity bright conditions. So this is the dynamic range. What is important, the camera can be mounted on any microscope, so you can use one system to different microscope which you might have available, and of course it is optimized for the best image quality. Here, the importance of the dynamic range. The human eye is capable of 100 decibels dynamic range. The typical DSLR which we might use to record our surgeries is around 40 decibels. High-end professional cinema camera has 78 decibels, and the Ngenuity has 85 decibels, which means that it is closer to the human eye. So, ultra high-speed graphic processor. The Ngenuity system evolution in the years is not only software improvements. They changed a lot of the hardware, they changed the main processor, they changed the GPU, which is the video card, and all these things are related to the fast image creation possible in order to not perceive the latency when you are working. The OLED display is important because it is also part of the latency. This screen is capable of 34 milliseconds latency. Combined with the capabilities of the Ngenuity system, it provides less than 70 milliseconds latency, which is important. So we can go beyond the limit, of course, of the analog microscope, because, for example, I'm presbyopic and I don't need to refocus during the surgery, and the image on the screen is actually my far vision. So it's important for the presbyopes, trust me. There is a data fusion capability, which means that during the surgery, if I need to see the specs of my machine, I just need to look on the edge of the screen, I will see that. Also, additional important thing is that I might work with reduced illumination light, which potentially will reduce the phototoxicity effect of certain dyes which I might use in posterior segment. Compared to analog microscope, these are the things that we need to know at first glance. 5-time extended depth of field, increased depth resolution, 42%. What is depth resolution? This is the focus of every point in the depth extension. I will show this later. 48% increased magnification compared to the traditional analog microscope, and the most important thing, in my opinion, are the personalized color profiles and light temperature, because we might do a lot of things with this, and I will show them in my presentation later. Here, this is an example of how big is the depth of focus. You can see without any contact lens or biome to the eye directly the vessels on the fundus. So this is only because of the depth extension of the Ngenuity camera. Here, this is example of depth resolution. You see how this huge macular hole is in focus, and all the length of the branches of the forceps are in focus. This is depth resolution. So we have good resolution in all our viewing spectrum. Here, of course, I'm trying to remove a membrane in order to handle the situation. It's complicated. Here, we can view in great detail in anterior segment. For example, this is the VVT EDOF element, which we might, it's interesting to see how the lens works. So you just need to appreciate the details. Another thing, zoom, magnify, and have a good resolution. Here, this is a microscope Lumera with Ngenuity, and the microscope is near to the maximum magnification. And you can see the thickness and the texture of the instrument, and you can also see the cortex, and you can appreciate the image quality of that. So you see the opening of the instrument, everything is on focus. Again, depth resolution. Another thing here, would I allow myself to tease the capsule like this if there was a perceivable latency, which means that what I do, I will see later on the screen? No, I don't have any latency, so that is why I allow myself to tease the capsule. Otherwise, I will create easy PC rupture here. So, in my opinion, or at least in my hands, there is no latency with the Ngenuity. This is an example of gonioscopy with Mori gonio lens, and you can appreciate the structures of the angle. You can also apply a digital filtering in order to enhance certain structures of interest. So this is the next door which will be opened in the digital visualization, the digital filtering. So next thing to show is a classical express device implantation. So here you need to appreciate the texture. You need to appreciate the quality of the image. You can see everything from the sclera. You can see everything that you do. And most importantly, all these procedures are done heads up. There is no need for returning to the analog microscopes oculars, at least for me. Here you can see the maximum magnification. It's different filters applied over the sclera, and you can see a lot of details. Here, this is part of the intrascleral flap and deep sclerectomy. So, personalized color profiles and light temperature. There are two ways to do this: white balance, and if you prefer, you can adjust your own image. So personally, I would advise to start with white balance because the system will maintain the best possible color output, and then you can start to create your personal profile which will fit your expectations. So in the software 1.431, there is a integrated palette of filters which are useful in different surgical situations, and it's really good to have it and to try them. I took this a little bit further, and I created a year ago my personal filter profiles. You can do whatever you want with the image, and you might be amazed what can be achieved. So here, this is the Fundus Reflex Enhancement digital filter. Here, this is a regular view, and you see the transparency of the pieces. It's not so good actually, and when you switch to the Fundus Reflex Enhancement filters, you might see a little bit more information, and you might crack the nucleus more safely because you can perceive all the depth and transparency of the pieces, albeit there is a cataract here. So the digital image has a lot of things inside as information. Here, this is a contrast enhancement filter. You can see the regular view, a little bit more exposed regular view. This is another filter, and this is the contrast enhancement filter. What is the idea? Is to increase the difference of the contrast between transparent tissues, because they are transparent but with different refractive properties. So you might benefit with digital filtering, and you might be a safer surgeon, because when you see what you are doing, you might induce less damage to the structures. Here, this is a myopic eye. We know that the fundus is pale and the peeling is hard, difficult. This is ILM enhancement filter, which enhance the already stained ILM with membrane blue dual. So it's useful when the structures are with less color differences. So here, for me, it's easier to see where is the stained ILM. And here, this is a complex trauma reconstruction case. You can do a complex anterior segment maneuvers because you see perfectly well without latency with good depth perception. Here, this is a Gore-Tex fixation of the same patient. I show this because it represents the complex communication between both hands of the surgeon. When you start working with Ngenuity, for me, it was most difficult to suture than the other procedures. So I would advise to start with suturing on mock things like tomato, grape, or something like that, just as a start. So here is how we finish more or less this case. What is another thing which is important, and it might make the Ngenuity the multimedia center of your operating room. You have the ability for picture-in-picture, which means that you can put any diagnostic or other image on the screen, which means that you can use OCT, you can use diagnostic images from camera. You can also use your phone when you broadcast from your operating room, and you will have that on your screen also. So think as the Ngenuity as the center of your multimedia distribution network in the operation room. What is important? Intraoperative thermovision can be achieved. It's important for scientific works, or if you want to titrate your power delivery in order to be safer to the cornea. So here you might see how the tip glows, and by the color of the tip you might orientate yourself how much power you deliver to the eye, or to lift your pedal, leave a time to cool, and then continue with your phaco surgery. Here, another interesting application recently developed is the intraoperative Fundus Fluorescein Angiooscopy, which is really useful in complicated cases like the PDR cases. It might affect your decision how many lasers to put in that eye, or if, for example, if you have some type of not regular retinal detachment, and you might think if this is an exudative retinal detachment or not. Here you can see that it's clearly not exudative, and your approach will be different. On this case, this is an advanced PDR case where we can see the massive capillary dropout, and of course it's a pity to see that during the surgery, but you will know what to expect on the next day and what to say or to show to the patient on the next day, because sometimes the anatomy doesn't fit the function. And here you can see this intraoperatively. How to get the best image quality from the Ngenuity? When you start, you better dim the lights in the operating room, because if you have a lot of reflection, they might affect the image from your screen. The best starting point for the screen is around meter and a half from the surgeon. The best starting point of the slider of the depth control is 30%. This will fit perfectly well anterior segment job and posterior segment job. Then parafocalize, which means, which means this. Increase the zoom and focus the microscope to the limbus, but the zoom should be on maximum. Then you return the zoom and continue with your case. It will provide continuous focus during the surgery without need for refocusing. This is what happens with the Alcon surgical visualization portfolio. At the beginning, data fusion was available only for the Constellation. Later on, it became available for the Centurion, and what is important is that it is wireless data fusion, which means less cords in the operating room, and it's more advanced solution. So it's important to know that the Ngenuity is and will be the center of your technology integration in the OR. These are my references, and thank you for your attention.